Jerry, welcome to Health Connection. Always good to have you here. We appreciate you being with us. We have a new topic, advanced practice providers, their growing role. You know, when you and I were growing up, it was real simple. There were doctors and there were nurses. But we now have this whole group of new medical providers that we call in a group advanced practice providers. They include nurse practitioners, physician assistants, which is what you are, nurse anesthetists, clinical nurse specialists, nurse midwives, all this group of professionals. Explain the role of an advanced practice provider and how they are different from a medical doctor.
Advanced practice professionals grew out of, in many ways, a shortage of physicians in the mid-60s. Physician assistants grew out of a program at Duke University. We were trained as using the medical model, fast track model that was used during World War II. It was made up primarily of Navy corpsmen. Our role at that time and continues to be to extend the role of the physician both in primary care and also in working in specialty care. Nurse practitioners also grew out of the same physician shortage, started at the University of Colorado. They were trained in a nursing model with advanced nursing and advanced medical training to be able to provide care. Nurse midwives, they've been around since eternity. They've been helping to deliver babies and helping take care of GYN problems for a long time, and it's just grown more and more as a nursing profession. Certified nurse midwives began Civil War time frame with nurses that were providing care, battlefield care to the surgeons. Again, that profession has grown and expanded during World War II.
Well, let me amplify the question. All these areas of practice, how do they differ from a physician? What is the critical difference?
One of the main differences is length of training. Physicians will go through a 4-year medical program and then anywhere from a 3 to a 7-year residency program to practice their specialty. Physician assistants go through a kind of a mini med school at Mach 1. It's a 27 to 30 month program, full-time, in which we're trained to assume some of the roles of the physician. Nurse practitioners will go through a 30 to 40 month program of both online and also in classroom, and all of us will then have various degrees of clinical rotations where we actually learn our specialty. Nurse anesthetists we'll have a year of critical care before starting a CRNA program, and then the programs are about 30 to 40 months long.
You mentioned the history in answer to this first question, but let me just amplify on it. You know, they've been around since the 60s, but when did we start seeing them in numbers? When did it start to really grow?
Probably in the last 10 to 15 years. It's kind of exponentially increased. Roles and responsibilities, and again, some of that has to do with the physician shortage. The Affordable Health Care Act also helped increase the numbers because of cost containment.
Okay, and I think you just answered the question. It is growing rapidly, and the answer why is because there's just a need.
There is a big need, yes.
Okay. What drew you to become a certified physician assistant, and what are some of the typical things that you will treat during a day in the clinic?
What drew me to being a physician assistant was I had been in medicine as a hospital corpsman many years ago, then transferred over to the Air Force as an IT officer, spent a career doing that, but I wanted to get back into medicine. It was my way of getting back into being a healthcare provider. Was to go to a physician assistant program. I was a non-traditional student. I was the certified old guy in the class. Many other individuals go to NP, PA programs. Some of it is for quality of life. Some of it is the duration of training to be able to be a healthcare provider. You don't have the longevity or the number of years that it takes to become a physician, whereas you can go in and become an NP, PA, be able to provide health care and not have all of the other pressures that physicians have placed on them.
What would you treat in a day, typically?
I work internal medicine. I'm a certified diabetes educator. Most of my patients have diabetes. We'll treat all sorts of problems that are connected with diabetes and also general internal medicine, from the common cold to hypertension, high blood pressure, high cholesterol, heart problems. And then again, the proverbial complications of diabetes to include heart, kidney, and problems with the foot.
The two professionals in this area that we are most likely to encounter is the physician assistant, such as you, and the nurse practitioner. Compare and contrast those two.
Well, I guess to contrast is the way that we get there. Physician assistants, as I said earlier, train more in the same pathways that physicians are trained. We have the didactic classes, and then we have clinical rotations. It is a full-time program. Nurse practitioners will take what they have learned as a registered nurse, master's degree trained, and then work in specialty cares or in clinical rotations. A lot of the nurse practitioner programs now are distance learning that allows the nurse to continue to work in her normal profession, his or her normal profession, and gain the education. Once we get into the field, according to Texas law, there's very little difference. We're both authorized to do the same thing. We will assess patients, order tests, make diagnoses, write prescriptions, do various procedures, minor surgery to include laceration repair, taking out foreign bodies, writing prescriptions, the whole gamut of what physicians will normally do also.
We all know it's well publicized. We have shortages of physicians. We have shortages of providers in the healthcare industry, but most particularly shortages of primary care physicians. How does that put pressure on, and how does that make it more necessary for physician assistants and nurse practitioners and these other advanced practice providers?
As we continue to grow as a population and our healthcare needs, with the baby boomers and just the general health care that we need in underserved area, I believe that the role of physician assistants, nurse practitioners is going to continue to grow. My mother was a registered nurse, went through nurses training in the mid-40s or early 40s. Back then, the ownership of a stethoscope belonged to a physician, and she was so excited when they learned to take blood pressures. As medicine has continued to evolve, we've needed to have more and more individuals that are specially trained, such as nurses, such as nurse practitioners, physician assistants, to be able to assume some of the roles previously handled by physicians, because there's just not enough time in the day for them to be able to take care of everything.
Well, I mean, just let's follow up on that question. We know back in the days that you're talking about, we all had the family doctor. Mm-hmm. Can an advanced practice provider, a nurse practitioner, a PA, can that person now be the family's primary caregiver?
Yes. I have a panel of patients that I follow. Many of my friends downtown, both PAs and NPs, and also here at the health center, will have a panel of patients that they call their primary care person. I continually remind my patients that I am not a physician, I'm a physician assistant, and they still want to call me doctor because that's a relationship that we've developed.
Well, yeah, you can understand that because you're sick, you go get fixed, you went to the doctor, mm-hmm. and I understand that. Are physician assistants, nurse practitioners, and other advanced practice providers changing the delivery model of healthcare?
To some degree they are. I think it's a way to be a little more cost effective in that a physician can have a group of advanced practice providers working with them to deliver healthcare to a larger population, be able to manage the more complex cases, or in some cases just to provide insight into overall treatment and management plans.
So how important is it for patients to understand about advanced practice providers? How important is it to educate the public on what you can deliver?
I think it's very important to understand that as a quote non-physician provider, an advanced practice provider, that the delivery of care that we provide is comparable to physicians. Several studies have been done comparing nurse practitioners, physician assistants, and physicians in a primary care mode. Patient satisfaction was equal across the board. Delivery of health care and overall outcomes was equal. When I first started, it was, well, I want to see a doctor, I don't want to see a PA. And as we've grown along, and as the reputations of individuals that have been in the field before me and also after me, as those reputations have continued to grow, patients are less resistant to seeing either a PA or an NP in a primary care arena.
Very well. Jerry, we learned a lot. Thank you very much.
Thank you, sir.